video link, we have Alan Maleche, who is the Executive Director for Kellen. And Kellen is an NGO that deals with health and human rights. So far, we've looked at a number of things in regards to what you need to know. Now, sorry about the disconnection there, Alan, but one of the things that I'd also want us to look at is the question of isolation centers and quarantine centers. We've had many complaints for those who are there, several of them. One of them being that they're being kept there longer than is necessary. What would you say to that?
So this is a very important topic, and Kellen, working with a number of other organizations and individuals in quarantine and family members of people in quarantine, have raised concerns, particularly 4 concerns about the issue of quarantine. Starting with the first issue that you raise, is that when people were taken into quarantine, we will not even discuss what happened at JKIA for now, but when people were taken into quarantine, the clear direction was that you'd be there for 14 days, and if you tested negative based on the guidelines the Ministry of Health had, then you would be released. However, on the 10th or 11th day, people then received information from the media that where there was a positive case in any quarantine facility, they would be held for an additional 14 days so that they can then be subjected to a secondary test or a confirmatory test. And that was the concern that many had, to say that if I had practiced social distancing, if I had not come into contact with the person who was tested positive, what would be the justification of keeping me longer, as against the initial guidelines of the ministry that said that after the 14 days you can go further and self-isolate. Other concerns that have been raised is about the poor and the deplorable conditions in the quarantine facility, particularly for those who are in government or schools. We have seen some places are not ventilated, some standards are not hygienic, the toilet facilities are shared, and that has been a major concern. There's also been concerns about the psychological effects of those in prolonged isolation. Those who have diabetes, are pregnant, have comorbidities is also a concern. But the bigger concern for people has been the cost, particularly for those who have had to incur a cost for additional 14 days, whereas on their end they have not done nothing that has breached the rules. That has been a challenge for those who are both in the government facilities and those who are both in the hotel facilities that were quantified by the government. But I think the major concern many people have raised, and they have actually written an open letter and requested for specific responses from the Ministry of Health, which have not been forthcoming, is the fact that information has not been easily flowing to them to be able to tell them, are the hotel staff or the even healthcare workers who are taking care of them, have they actually been tested? And from what we've seen from the media reports, they only began testing the hotel staff on this second round, which means there could have been a risk of exposure. And there have been very many testimonies around how social distancing has also not been followed by the same government officials in the way they handled people from the airport to the hotels, and even how they dealt with communicating this message with them. So there are challenges. We have asked questions in terms of asking for this information to be made public, but I think the issue of mandatory quarantine is an issue that needs to be interrogated deeply, because we have made some progress in terms of ensuring we don't spread the disease, but in the process, we have affected people's psychology, we have affected people's health, we have traumatized people, we have failed to provide information, and that is something the Ministry of Health needs to honestly and deeply reflect about, because this is not the only time we'll quarantine people. There will be other diseases that will require quarantine. We must ensure that we do the right thing, take the right steps, and don't suspend human rights, particularly right to information, right to dignity, right to the highest attainable standard of health, right to non-discrimination. All those should be upheld when you're carrying out quarantine or isolation. And there's actually guidance from the world of TB, because the TB program at MOH actually has an extensive policy around what are the steps you take before you quarantine a person, before you isolate a person, and many of them point towards providing information, providing support, providing proper counseling, and these are things we've not seen in the case of how the government has then effected its mandatory quarantine policy.
All right, and you bring in an interesting aspect, particularly the psychological side of it, because just like COVID-19, with psychology, one may not be able to tell how much damage is being done to some of those people in the isolation and quarantine centers, and this may not even be visible or possible to quantify now, but later they may realize. For instance, one might have a trauma that is caused just by, being in that place. What redress would one have even after, should you discover that as a result of being locked up or being in those isolation centers, you are traumatized in one way or the other?
That's a very good point you raise, and I think one of the redresses people should consider, one is asking the Ministry of Health to consider providing psychosocial support for those who may have been in quarantine and have been traumatized by those particular situations. That's one way to go about it, and if the ministry is not willing to do so, then people would have the redress of going to court to be able to ask for access to those particular services, or for the government to bear the cost that they may have incurred for having to seek psychiatric or psychosocial care that has resulted for them being held up for longer than is necessary, or in conditions that have put them into a difficult situation. I think one of the other things that is also causing people psychological stress or trauma is the turnaround times for testing. We are aware that the people in KMTC have been tested for a second time on Saturday, but their results have not yet been made available to them. And many who have communicated with us are actually stressed about this because they don't understand why it's taking too long to turn around the results. Yet the guidelines indicate the results should be made available within 24 hours. So the lack of communicating essential information to the people within the quarantine centers is also providing a source of stress and tension that could actually see that being emanated by attacks on healthcare workers who are the front line and cannot defend the decisions made at the higher level.
All right, and now another cause of concern, of course, for many Kenyans is food, just basic food. Here we are, of course, being given advisory that we should stay home and stay safe. But there are those who cannot stay home because that means they cannot eat. There's also the question of PPE, personal protective equipment, just like masks. Not everybody can afford. Where do we go to when we want to obey the rules, but naturally we cannot? Because, if I don't have food, there's no way I'm going to stay home.
Correct. I think you raise a very important point, and this is something we have clearly articulated in an advisory to the government, to say that if you're going to enforce curfews, if you're going to enforce lockdowns, then you must take an approach that ensures you've catered for access to food, access to water, and other important social amenities, particularly for those in poor and informal settlements. Because if you do not take care of that, it will be next to impossible to ask someone to stay at home if they are not able to put a meal on the table. And if they're not able to put a meal on the table, that may likely lead to tensions within the household that may contribute to the spike of gender-based violence that we've seen being reported by the Office of the Director of Public Prosecution as cases that are coming up. And also the fact that when you pass regulations that have criminal sanctions, meaning you can be arrested for not obeying them, whereas you have not provided the things that are needed, then you're not being fair to those who are being poor or those who are poor in society, because I'll be grappling between buying a mask and buying food for my family. Where do I put the priority? And if the government has not provided a mask for me and I cannot afford one, why then should they arrest me the moment I do not have a mask? That would not be a good way to enforce adherence from a public health perspective. And I think many experts have written and said that using criminal law to enforce public health measures is very counterproductive, because you end up seeing that if the police round up people who don't have masks, they end up in a police cell, they are all together, they are more than 15, and that provides a conducive environment for the spread of the COVID virus. And again, these are lessons we have learned from the TB world, where public health officers would frequently arrest persons who have TB, who have interrupted their treatment, and then decide that the best place to put them is jail, where they can then be able to adhere to their treatment. But by putting them in jail or prison, you're exposing them to other people and encouraging the spread of TB. This is what we are exactly seeing with the COVID guidelines around masks, around social distancing, and people also posted on social media saying, how do you determine how to have only 3 people in a private car, whereas you're happy to have 6 people in a private house? Are you really thinking through the guidelines and the regulations you have put in place and the practicality of enforcing them?
All right, so what would your advice, as we wind up, what would your advice be to government and to the Ministry of Health in regards to ensure that we walk that fine line of balance by making sure that there is adherence to what the guidelines have been given, but at the same time, in a humane manner? We've just given one example of food versus the mask. If I am battling between buying food and a mask, I definitely would go for food. So how do we get that balance to ensure that there is adherence, but at the same time, in a humane manner?
So I think the first recommendation I'd give to the Ministry of Health officials, who I know are working extremely hard to address COVID, is that instead of focusing on criminal measures, they should concentrate their efforts on enhancing effective evidence and rights-based interventions in their COVID response. This means that we should be addressing the socioeconomic needs of people: food, water, access to healthcare services, especially for those who have things like diabetes, hypertension. We should be focusing on how do they get those services instead of focusing on how they would be arrested. We have seen cases of women rushing to hospital to deliver, but those who are taking them being attacked by the police because they are out of the curfew period. We also need to see transparent and clear public health messaging. We need to see widespread access to testing. And finally, provision of support services, especially for the vulnerable and those who are marginalized. And I repeat again, criminal sanctions should be used as a very last resort in this COVID response.
All right. Finally, Alan, that is to government, but now to Kenyans. There are those who really want to obey and follow the rules and regulations given by WHO and the Ministry of Health, but you have not been given a solution for those basic needs: shelter, food, and whatever else you'd require. How do they go about their wanting to be a responsible citizen, but at the same time, you have the basic need of human being for food, like for instance, food?
So I think my advice would be for those who are able to afford food, for those whose employers are able to still keep them on the payroll and are able to stay at home, they should adhere to the guidelines and direction that the government is giving on social distancing, washing hands, keeping safe. But for those who are not able, I think it's important that their plight is documented. This is communicated to the Ministry of Health. This is communicated to the COVID fund that seems to be in place, and find a way, working with both UN agencies, civil society, community-based groups, to find mechanisms where we can find a way to provide some of these essential issues of clean water, hygienic standards, provision of food, provision of public health information to people who need it most. I think government must have very clear and transparent mechanisms of showing how they are getting there. For now, the absence of this information from government as to how they are reaching those who don't have food, as to how they are reaching the vulnerable, is what is causing a lot of tension among those who are not able to afford to say, if I can't get food, why should I stay home? If government is not communicating clearly how I will get food, how I will get access to hygienic water, how as a healthcare worker I will have access to protective personal equipment, that will ensure that I can ably serve Kenyans to be taken care of. So for me, my clarion call is that if you're in that position, reach out to civil society organizations like Kellen. Let us document this and communicate this as quickly as possible to government, so that government can then know that there's this particular issue that they need to quickly take into account, beyond ensuring that people are tested and more people do not get infected and we do not lose any more lives to the COVID virus.
Thank you very much. That is Alan Maleche, Executive Director. Kellen, thank you for joining us this morning via video link and giving us information on how we obviously need to ensure that we are responsible citizens, but at the same time, government is also responsible to ensure that they provide the basic needs.